I learned that I want to go into orthopedics partway through my medical training. Let me explain. I knew from a young age, even before I got into high school, that I wanted to go into medicine. And so all through grade school, all through my high school, through university, that was always my target. But I didn't know what aspect of medicine that I wanted to go into. During university, I had an opportunity to get my first exposure to the surgical discipline of medicine, both as a volunteer and an observer. And I really thought at that time that this is what I want to go into, because I'm a kinesthetic learner, and as you can see, I like to use my hands. I like to work with my hands a lot. So I thought that surgery might be a good thing for me because of the surgical procedures and the ability to use my hands. During university, I was a varsity football player. And as a football player, I had a lot of opportunities to collide with other players. In some of those instances, I ended up getting hurt. So as a result of some of the injuries I suffered during football, I actually had to have surgery myself. And this was my first exposure to orthopedic surgery. And from that point, my interest was really piqued, and I thought that this might be what I want to do. As I had more exposure to orthopedics over time, and as I progressed through my university education and then subsequently my medical training, I started to realize that orthopedics is something that was very near and dear to my heart, because I had been an athlete all of my life, and I had been always involved with sports. And with orthopedic surgery, this was something that allowed me to combine several of my passions, both my love of sport and then also my interest in surgery and wanting to do things with my hands. I used my time at medical school to crystallize my interest in orthopedics by exposing myself to other specialties in addition, just to make sure that I hadn't prematurely selected my path. And although there was other specialties that I was interested in, OB-GYN, general surgery, I really found that orthopedics was the one that best suited my temperament, my vision, and the things that I wanted to do with my life. So when it came time for me to make the decision, I was pretty much set on orthopedics. And when I applied in my fourth year of medical school for residency programs, I applied to all of the orthopedic programs in my country and only one general surgery program as a backup. Always have a backup. And in the end, I was selected to an orthopedic surgery program, one of my top choices, and the rest is history.